the stage. Tiernan is the Manager for Environmental Sustainability of the Victorian Health and Human Services Building Authority. Now, Tiernan is a sustainability leader with over 20 years' experience in the public and private sectors and degrees in environmental management and town planning. Since 2008, he has been the Manager of the Environmental Sustainability at the Department of Health and Human Services, and he's responsible for providing sustainability leadership in the state's public health systems. In 2016, he was awarded a scholarship from Yale University to attend the inaugural Sustainability Leadership Forum. So I'd like everyone to join me for a very warm welcome for Tiernan Humphries.
Thank you, Grace. And thanks for the invitation to speak today. And I'm going to talk today about how we spent our last 12 months delivering on the first year. Is this going to make me sound like a chipmunk? No. About how we spent the last year delivering our environmental sustainability strategy. It's also great to see the Parliamentary Secretary for Health is going to be here, Anthony Carbine's, tomorrow to talk about what he thinks around sustainability and health, which is a great indication of the level of support that we have here in Victoria to improve the environmental performance of the health system. So as everyone knows, the Victorian government's got a legislated target to be net carbon zero by 2050. And there will be requirements for emission reduction pledges to be made for the whole of Victorian government as a whole, and that will be for the first year will be 2021 to 2025, and then every 5 years after that. And this will be legislated for our larger public health services, which I'll talk about later on. So for those who haven't seen our strategy, hands up who has, just for the time, so most people have. So we released the Environmental Sustainability Strategy 2018, 19 to 2022, 23 in, I think it was October, November last year, so about a year ago. It's got 3 strategic directions. So the first one is around providing leadership and engaging with the sector. The second direction is around improving the environmental performance of the health system, which is where I think the majority of my team's work has been for the last 10 years. And the third direction is around adapt to a changing climate, which is a relatively new space for us, but it is one that is incredibly important. So I think there's going to be a couple of presentations on the carbon emissions profile of the health system, which I think Joan Coe from ARAP is going to be talking later on today. I think Forbes has said he's going to do some stirring later on, so I look forward to hearing that. So this is what work we did a couple of years ago. Some of you may have seen the slide before. So in Victoria, the health system is around 1% of the reported carbon emissions of Victoria, which is the 967,500. The light blue there is the other part of the DHHS portfolio, which is largely our public housing. Interesting that most of the public housing is scope 3. Most of the health is scope 2 and scope 1. You can see that our biggest emission profile is very much electricity, followed by natural gas. So some of the gaps we have that we're going to be focusing on in the next couple of years is around what's the emission profile, the embodied carbon of capital works. The Victorian Health and Human Services Building Authority Forward Capital Works Programme is huge. Health consumables, so things we use. Scott McAllister will be talking about some work we're helping him do around the life cycle analysis and carbon footprinting of pathology testing. So that's that'll be really interesting. Starting Visitor transport is a pretty big one. Refrigerant is also one we use in air conditioning. Medical gases is something that we will focus on this year. Vehicle fleet, we looked at it last year, so it's going to be reported for the first time in this year's annual report. Actually, the fleet emission profile is pretty small in metropolitan hospitals, if you exclude ambulance. Very quickly, costs. Energy, 148 million per year. We begin to look at also breaking it down to per bed day. So carbon per bed day is 920 kilograms. Water per bed day, 600 litres. So this is a lot of from the water coolers. We just don't have very thirsty patients. It is water coolers to provide cooling that we heard about earlier from direct energy. Waste is a particularly big one, 3.5 kilograms. Recycling rate of around quarter. So Western Health at 30% is above the average, which is what I would expect. And also copy paper use per FTE is also quite big. And good to see that EMR is actually reducing that. So our big program that we have is the Green and Government Buildings program. It's a whole of government program facilitated by Treasury. It provides no interest loans to invest in energy efficiency in solar. All the current funding is currently allocated, so we have no new funding, so please don't email me and ask because I haven't got any more. You can ask Anthony Carbines tomorrow though, please do ask him. He's got much more sway than I have. The loans can be paid over 5 years through reduced energy costs. So over 15-16 to 19-20, which is this year, we've invested or are investing 30 million. So it's a fairly big program. Emission reduction of around 117,000 tonnes to 2026, which is the first pledge period. So that is quite a lot. And also, once all the loans have been repaid, close to $6 million worth of savings, which can be reinvested back into the health system. Our big program is the Regional Health Solar Program, so it's a $13.5 million investment. That map there shows the blue dots is where we've installed solar. This does include some that was installed before the program, so the blue dot in the middle of Melbourne, that is the Western Sunshine Hospital. That's where we are at the moment. So we're installing just over 9 megawatt peak across 75 sites. So an average household is around 4 kilowatts. So you can do the sums there. It generates around 11 gigawatt hours of electricity per annum, which is around 2% of what we use. So it's a fairly small amount. And this is the largest solar array on a hospital in Australia. It's a hospital. It's 749 kilowatts. And there is a video of it on our website for those who are interested. Peninsula Health, anyone here from Peninsula today? Yes, very good. So this is the $7 million, did you know about this project? Yeah. Yes, good. $7 million energy performance contract, which has reduced the energy by nearly a quarter. Water savings not as much as what we call a water performance contract, it's an energy performance contract. But also carbon savings of around a fifth, which is around 4,000 tonnes. Here you've got some very happy, smiley engineers in front of the first battery installed in a public hospital in Victoria. To keep their drugs fridge to both the hospital going for half an hour. So it's not going to power the hospital, but it is a good way to understand what role batteries can play. And when someone asks me, what do you do? I say I change light bulbs. I actually mean changing light bulbs. 4,500 were changed there. Next one is a new one, which we're working through. This ties back to our emission reduction pledges that are required. So we've got $5 billion of interest-free loans for health services with greater than 5,000 tonnes. So they're the ones that are going to be required to make an emission reduction pledge. So around 27 of those, including Ambulance Victoria. So types of projects we're supporting, of course, solar is up there. LED retrofits, car parks, corridors and highways. Solar hot water, variable speed drives, and also replacing fluorescent LED exit lights with LEDs. So we're currently working through that at the moment. Other projects we have done, we are updating the environmental management plan template. So you know every public health service in Victoria has to have an EMP. We're updating them to align with the strategy. We're also just about to publish some resources around improving fleet efficiency. So there's going to be a template fleet efficiency management plan. There's going to be a cost-benefit analysis of moving to hybrids, and also a bit of thinking around what role do electric vehicles have in hospitals. So electric ambulances in a couple of years, these cats. It's pleased to hear that sustainability is back in the 1920 statement of priorities this year. So this is an agreement between the Minister for Health and the board chair. This time, the slight difference is every draft sustainability commitment comes through me first. If I'm not happy, it goes back to the health service. So it is about actually trying to put some more rigor around what that will actually achieve. So I'll talk about before we reported transport fleet data in our annual reports. In the policy funding guidelines this year, the reporting on vehicle fleet transport is a mandatory requirement. So begin to need to think about actually how you will collect that data. Sarah in my team is doing some work around sustainable transport at Peninsula Health and Eastern Health. So trying to get that back up and going. And Rachel, who I think is speaking tomorrow, is of course doing the Waste Education and Healthcare project. She's just back from Sri Lanka, so there might be a few slides on elephants, I'm not too sure. So what's our focus for this year, even though we're already a couple of months in? A big focus is on NEIGHBOURS, which is the National Australian Built Environment Rating Scheme. So we've got agreement amongst all the jurisdictions, who would have thought, to develop a NEIGHBOURS waste tool for hospitals. So that work will be kicking off. We'll also be releasing the 18-19 NEIGHBOURS ratings for all hospitals, hopefully the end of 2019, early 2020. There's some good news in that and some bad news. So I suspect those that are above average will publish theirs. Those that are below average probably won't. But we hope to change that in years to come. Innovation grant learning. So we funded 12 innovation projects across 10 health services last year. So we're looking at actually capturing those learnings. So here at Western, I think, Chris, now you need to finish a couple of projects for us. There's a life cycle of pathology testing, which is in conjunction with Austin Health, an e-learning package on waste, and also the determining the energy use of diagnostic equipment. A lot of work on GDB, which takes up the majority of my time. Sustainability guidelines for capital work. So these have been going, they've been taking a lot longer than we expected. There's a fair bit of work in there, but hopefully by the end of this year, or early 2020, we'll be releasing those. We're going to be increasing what we expect as standard practice, but also giving a lot more direction on what we expect the 2.5% ESG budget to be spent on. And I think Simon's going to talk next about the NCC upgrade, which is definitely a big change in that space. So we will be looking at reporting medical gases in our annual report this year, so for 1920. So we'll be working with HPV, I've got no time left. Automatic upload of solar, so walk through with that for a moment. And I just added this slide in recently, i.e. about half an hour ago, because of what Tiernan said. So Victorian Health and Human Services Building Authority is moving. We're moving to 2 floors in 35 Collins Street, which is a big, ugly beige house. But we are seeking WELL certification, so we actually are targeting a gold. So there's silver, gold, and platinum. We're targeting gold. We hope we will get there. Here's a couple of things that we're doing. This will be, I think, the only second public building, public government building in Victoria to get WELL certification. The other one is WorkSafe in Geelong. Oh, that's it. Thank you. Time for questions?
There is time for one question. Who's the lucky question?
Today.
Oh, fantastic. Yep.
Can we go to Queensland, Stephanie? Okay. So the way PPAs are accounted for in Victoria makes it very difficult. PPA is a power purchase agreement. It's a quick answer. It's a quick question. It's a very long answer. Power purchase agreement is where you enter into an agreement to buy electricity from a wind farm or large-scale solar. So the way it's accounted for in Victoria is that it's actually accounted for as an infrastructure liability over the term of the PPA. So Western Health, I think, spends $6 million a year on electricity. A 10-year PPA is $60 million, which contributes to net debt, which the government doesn't like contributions to net debt. Net debt affects your credit rating, which affects your electability. So there is a bit of work to do there around accounting standards. They are international accounting standards, they're not Victorian. So we're continuing to work with Treasury. The last electricity tender we went out a couple of months ago, we did include a PPA option, but none of the energy retailers came back to us with an actual offer. So it's not as though we're sitting on our hands, it's just a lot harder than the media make it out to be.
All right, we'll squeeze one more in.
GDB, green and government buildings. Yeah.
Oh, we do have a couple of minutes, sorry. Okay.
Stephanie, do you want to ask your question? Yep. So the fleet efficiency plan template is basically a template that you can fill in that will look at how you can improve the carbon efficiency of your fleet. So it's around reporting makeup of your vehicles, driver behaviour. They'll be on our website by the end of the month.
Excellent. Well, thank you, Tiernan. An inspiring and amusing update on environmental planning strategy. And I'd like